I'd like to introduce our president and CEO, Mary Holland.
Michelle, thank you so much. It is such an honor and pleasure to be here. I want to thank all of you for coming. I want to thank our board members and Michelle as our chair. But if you raise your hand if you're on the CHD board and a past member of the board, I'd be grateful. We would not exist without you. We're so grateful for all that you've done. And we're grateful to the chapter, Maya and Alexandra. Thank you. We have a chapter here in Florida, and we're very grateful. So I was asked by, there's Susan. Hi, Susan. I was asked by Michelle to talk about our vaccine work. That is at the heart of what we've been doing. It's not the only thing we do. We care about food. We care about pesticides. We care about geoengineering. We care about electromagnetic radiation. And we cover those in the education and advocacy that we do. But in the original work that we do that you'll hear about in litigation and in science, we've focused primarily on vaccines. I want to clarify, so our founder is Bobby Kennedy. We are so thrilled that he is now the Secretary of HHS, right? And that's thanks to all of your support, right? I don't know that any of us fully imagined that that's where he would end up, but it is the perfect place for him to address these things. And what he's talking about, well, next, George, let's start with HHS and build on HHS. All right, thank you, George. But I think his mantra are our mantras, and they're mantras that he held when he was at Children's Health Defense. And that is radical transparency, gold standard science. That's what we stand for. We're characterized as an anti-vaccine group. That's not true. We're about telling people the true risks and the true benefits. And sad to say, the benefits have been wildly overstated, lots of lies about the benefits. And the risks have been vastly understated, lots of lies about the risks. We want people to be free. We want people to be able to make their own decisions. I think most of us, many people on the staff and the supporters, we've suffered from vaccines. We've suffered from the lies. And so I'd be hard pressed to take a vaccine anytime. But that doesn't mean that the organization is against people's free choice. What we really stand for are parental rights, informed consent, bodily autonomy. And that's really important. We are not doctrinaire. It is not an ideology. You get to make the decision, and you need truthful information to do that. In line with what Michelle said, what we really care about is healthy children, ending the epidemic of chronic disease. Over half of our kids have some kind of chronic health condition. 77% of our kids couldn't qualify to be in the military if they wanted to. We don't have a healthy population coming up, and it's our responsibility as adults to turn that around. One of the things I love that Bobby Kennedy said in the confirmation process was, healthy people have 1,000 dreams, a sick person has just one. And that is so true. We need to have kids with big dreams and not just dreams of being healthy again. So that's our job. So one of the things we have 4 pillars, we say: education, advocacy, science, and litigation. And one of the many things that makes us truly unique is that we have a full-time science operation within Children's Health Defense. We do our own science. We don't rely on the CDC or the FDA or the NIH. We hope that one of these days we'll be able to do that. But until that moment, we really have 4 PhDs working full-time to analyze results, to get results, to look at the data, to figure out what are vaccines really doing, what's the truth behind all the fiction. So I'm really thrilled next to introduce my dear colleague, Brian Hooker, our Chief Science Officer.